That's why you shouldn't even screw.
Okay, folks, it is 10 o'clock. Just to let you know, we are being live streamed, so is anybody on remotely? But you are live, so remember that if you need to say something. Anyway, we'll rise for the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. And the meeting is called to order, by the way. Public forum. I don't see a lot of people sitting here for public forum. Adopt the agenda. I know we've got some additions.
Mr. Chair, members of the board, if we could add a legislative update from Senator Jason Rarick as the first item on the regular agenda. And then also, if we could add regular agenda item 1.1, Insurance Committee Report. Regular agenda item 3.2, the MEND contract cancellation, and 3.3 would be a contract with Advanced Correctional Healthcare, and Rod Williamson, Jail Administrator, is here to address those. And then just a note that the Soil and Water Conservation District meeting has a new date. And then on regular agenda item number 1, we have the minutes of the Transportation Committee.
Okay, any other items? If not, we'd look for a motion.
I'll move, Mr. Chair.
Second.
Motion by Ludwig, second by Lovegren. Any discussion? If not, all in favor, say aye. Opposed? Approve the minutes of the June 21st, 2022 regular county board meeting and summary for publication. And minutes of the June 28th special meeting, committee of the whole.
So moved.
Second.
Motion by Lovegren, seconded by Moore. Any discussion? All in favor, say aye.
Aye.
Opposed? Minutes of boards, reports and correspondence, Pine County Surveyor monthly report for June of 2022. And the Pine County Zoning Board minutes of May 26, 2022.
I'll move that. Second, Ludwig.
Motion by Moore, seconded by Ludwig. Any discussion? Hearing none, all in favor, say aye.
Aye.
Opposed? Consent agenda. We've had that funny for several days.
I'll make a motion to accept the consent agenda.
I'll second.
Got a motion by Lovegren, seconded by Moore to approve the consent agenda. Any discussion? If not, all in favor, say aye.
Aye.
Opposed? And welcome, Senator Rarick.
All right, well, unfortunately, there's not a lot to give on a legislative update. We did get a couple of things done. We did a veterans bill and we got some funding out for some veteran services. And then we got the ag bill done. And so there was some drought relief and broadband funding in that. And I know that'll be, of interest to the county here with the broadband funding. There will be some to match some ARPA money to get some, not ARPA, but some of the new federal infrastructure money. And discussions are going on. And I know like East Central's plan for our area this fall, we're going to be working with the state. Right now there's a $5 million cap on what you can get through the grant process because they typically see a lot smaller projects coming in. We want to figure out, instead of ECE having to break this all out into multiple little projects to get the funding, can we get it so that they can receive a bigger amount than just the 5 million being there going on such a large scale? So that work will probably begin this fall to try to help out on that. So a couple of the issues that I had talked to Dave Minke about ahead of time, probation funding. That was something that on the Senate side, we had really made a priority on public safety. We were looking at, increasing some penalties for, carjackings, other things that we're seeing a lot of happening, and then backing up our counties with some additional funding to try to help out. So that will continue to be a priority if, next session, there was not agreement on it, so it didn't get done. But I know that's something I'll support, and a lot of folks do support, and the discussion is continuing to happen. We have to end that revolving door, and I know we don't have that issue here in Pine County, but we're starting to see some of that move our way from the metro area. So probably not as bad as what we're seeing along the 94 corridor, but likely to come. So definitely gonna do support what I can to help out with that. PILT funding, that's always an issue that we have here in the county. One of the biggest ones that we see is when they use legacy money or things like that to buy land. And I haven't seen a whole lot of land in Pine County lately that has been being applied for any of that. But that's something that I've been pushing for a long time, is that part of that purchase price has to include PILT, and we have to work on some of that formula. As we have a certain number of counties that just have very high percentages of land that are state or federally owned, and that really hurts the property tax owners in the counties, especially when we're taking more and more off the property tax rolls. We all know it just shifts that burden. So that's something, and I haven't been on a local property tax or tax committee for a while, but I do follow those because I know how important that is to, both Pine County and Carlton County, especially, and Kanabec would be included too. It's just not property tax rich counties. So another one is what we've been working on, the SSIS paperwork reduction. We're seem to be getting a lot of support from both sides of the aisle on that, but the agency just doesn't seem to be engaging with us. So hopefully we'll continue those conversations and work. They seem to be like, well, the legislation could be, well, we'll try to work on it. And I hate when we do things like that because it doesn't mean anything. So, but I think we see this across the board in so many areas, whether it's nurses, teachers. It's the amount of paperwork that's being required to be filled out is just taking away from time when you're actually doing things and helping people. So that's something I'll be committed to, and I'll continue to carry the bill and work with you guys and the tribes and everybody involved. So, and then the last one, the county program aid, in the tax bill, unfortunately, it did not get done. It was, that was part of the disappointment this year. It was supposed to be a year for bonding and policy stuff. And because of the large number in the surplus, that took all the attention. It almost became a budget year. And in my opinion, we should have done a bunch of tax relief with that. We were trying to come to an agreement on it, and we just never got there. The tax bill, actually, the portion, the $4 billion that was committed to the tax bill, there was agreement on, but we couldn't get that passed without the agreements in the other areas, unfortunately. There was
Stuff hostage.
exactly. They talk about the global agreement. And so people who wanted increased spending were not going to vote for a tax cut until the spending was agreed upon. And we were so far apart on how we would spend money. We just couldn't get there. And that's why there's the talk of a special session is gone. Even 2 months later, we're no closer to an agreement on how that would be done. So there were a number of things in the tax bill. There was some tax relief geared towards individuals, and there were some tax cuts geared towards helping local governments and to help potentially reduce property taxes. So I unfortunately don't remember all the details of what was in that, but it was, I thought it was a pretty good plan to kind of spread it out and not just hit, one particular group. And it would have helped local counties and cities a fair amount to either help them cover some expenses that were coming up or to help them reduce their property taxes. So hopefully those can being that was agreed upon, hopefully that is something that when we come back, we can have that agreement at least. There might be some changes, but hopefully be pretty close to that and roll that out fairly early. And also the bonding bill is something that when it did not get a lot of attention early, like I said, the focus was on the surplus. And I know Tom Bach, longtime senator, we made him the chair of the bonding committee this year. And I heard from him over and over just the frustrations that he had. They had a very new member in the House as the chair of the committee. And, Tom Bach is always willing to negotiate and compromise and work on something. And he just was very frustrated that the chair of the House didn't understand that concept. So, and I think by the time they got Speaker Hortman involved to try to get it done, it was way too late to get it done. There were a number of good projects. I think there was a lot of focus on water infrastructure and on state asset preservation. And those are all the things that I support out of a bonding bill. I don't like funding a civic center or, some of those things, but there was a lot of asset preservation, road projects, water. So hopefully, I know Senator Bach is not going to be back, but I think his staff people will be, and he was involving his vice chair quite heavily. So hopefully a lot of stuff is in place, and I think it can be done pretty quickly when we get back in January. So
Do you think it'll be January before we see a bonding bill? You don't think there's any chance of moving that forward?
the last I heard, I know Senator Bach was willing to continue negotiations and to keep talking about it, but the last I heard, there just hadn't been any real discussions at all over the last month. So
Locally, the Pine Tech project is probably one of the biggest projects that would happen in a bonding bill
yeah,
for a long time around here, and I don't know if we may or may not lose out on $5 million worth of federal dollars because of the bonding bill delay. So
right. Yep. I've been talking a lot with President Mulford about that. We had Senator Bach was absolutely committed to having that project in the bonding bill. It was there. But yeah, they had a $5 million grant from feds that was contingent on getting matching money, which was what the bonding bill would have provided. So I'm working with him. There's always things happening with that, and there's potential to get it. And we're looking at a couple of other options to try to lock that 5 million in place, but it's not, I think, what did he say? Believe it was sometime in August. He needs to know, and there's no way the bonding bill will happen by August. So, and just because it's an election year, like the one year we came back in October and had a bonding bill, I just don't see that happening this year. So, but a lot of the things that it's all there, and it could be early February when the agreements are made and things are passed, being so much of the work was already done. But that's unfortunately the earliest I would see the bonding bill getting done.
Mr. Chair. So what seems to hang up the probation funding discussion though? I mean, that to make it full, what holds it up? Just the dollars or?
There's a group that's at the Capitol right now, and they are just opposed to police, and they're opposed to
It's still the.
Incarceration.
Defunding the.
Yep. So they're set on exonerating people and more, and that's a part of what I don't understand with the probation either is like, well, at least if you don't want to incarcerate them, put them in a probations program and keep an eye on them,
It's gonna make more.
which
work.
is going to require more. But it's just not, and there's a pretty, they got a pretty loud voice over in the House and they're not gonna let any of that go through right now.
Wow, so the legislature basically is saying they're not taking a stand either way then. You guys, right?
The Judiciary and the Public Safety Committee on the Senate side, they had a lot of discussions about that and
House
they had
bill, I'm
in,
part of that one committee.
Yep. and they had funding in there for it. And the sad part is I still believe the majority of the members of the House would have supported that plan. But we've got it's kind of that loud, small but loud group that's not gonna let it go through yet.
Thank you. That's kind of what I thought, but it's.
Mr. Chair,
Yeah.
Jason, you had talked about human services and about the paperwork. Is there somebody that we can contact at the agency or that we can help with communicating with to see if we can get that to be an easier process for you?
The agency has been our problem.
I'm
Yes.
waiting to write down that name.
Exactly. I'm trying to find that name. So they have just
So which agency would it be? What would the name of the agency be that's causing?
DHS, Department of Human
Services.
Services.
Yep.
So would it be Jan Malcolm?
No,
No,
it's,
no.
See, I see her month.
I can never remember. Well, they just changed. It was Harpstead and now it just changed.
in any case, if I can just interject,
Yeah.
Mr. Chair, thank you, Senator, for carrying this bill for the last 2 sessions. I think each time we make a little more progress, we build a little bigger coalition. We've not gotten it into the end zone yet. The agency has expressed a willingness to work on changes absent legislation. We've not seen that, right? And I think that's exactly what you were saying earlier. Becky and her team are reaching out, have invited, members from the agency to come and look at what they do and what the issues are. And so we're going to continue to push on all fronts and, hopefully next session, you'll be able to carry a similar bill and maybe we can make a little more progress.
And we've actually had, now that we've been working on this for 3 to 4 years, there are other counties that have noticed it. And they're all like, yeah, so the more people we can get kind of involved in it to put more pressure on, I think that's going to be our best avenue for getting this done.
And maybe if we can strategize in a board meeting,
Right.
we need to put a little more pressure on AMC prior to the fall legislative conference to get it to be an AMC enumerated priority.
That's the one thing when you've got something like this, that the more folks you can, and the wider variety of folks you can get on board to support something like that,
Mhm.
the more pressure you can get to kind of push on the agencies. But DHS especially is pretty entrenched in their ways. Like I said, Senator Lori and I, we got along. We had some differences. But when he was made commissioner at DHS, I truly believe he was trying to make changes. And that got him on the outs with the longtime people who work there. And the governor sided with them instead of Senator Lori. So I think we'd have had a better chance at getting this through if Tony had still been the commissioner than if not with.
Thank you.
Anybody else?
I guess if I can, I just
Yep.
got back to PILT. Nothing, that seems like something that, health has to be shared with everybody in the state, right? It covers everybody, everybody's affected the same, everybody, it's the same formula for each. No,
No, that is the unfortunate thing. And there are a lot of places that are what's happened. It's happened with school funding. It's happened with PILT funding. It's happened with county program aid. Formulas have been put in place to try to help areas that they would be determined to need more help.
Mhm.
But I think over the years, those formulas have been twisted to benefit people that have the higher representation, especially in the school funding. You know, you look the the Minneapolis and St. Paul school districts get about 12 to 13,000 per student, where like Pine City gets 7. And so those are some of the things that we have to really start digging into and looking at. How do we get those formulas changed back to where it's more even? You know, I mean, I would agree, you know, our counties, especially, our property value is so much lower compared to the metro area and other areas around the state, that a formula should be weighted more for us. But right now it's not always the case.
yeah, then I guess I mean, there is alternatives which would be, is to opt out of the program by having no tax forfeited land, get it back in private ownership. And then we don't have to worry about who gets more, who gets less, or us getting nothing. Again, you know,
Right.
increase wise, I guess.
It's not just forfeited. land.
It's not just the forfeited land though. It's all the state land and things like that. And
Yeah.
like I said, the big one that I see happening is the land through the legacy funding and some of the others that, you know, these different groups are going out and they're buying and then they turn it over to the state. And like I said, our area hasn't been hit as hard. They're really focusing right now on Southwest Minnesota, which, you know, there's not a lot of public land there. So, but when you look at, you know, we've got some counties that are over 80%, you know,
Yeah.
publicly owned in one form or another. And if you start taking more, I mean, that's just
Yeah.
shifting more and more of that
More burden. Yeah.
on to the few
Right.
property owners you have.
Right.
So I think if we're going to look at those formulas, that's where you need to weight it towards, well, what's your percentage of publicly owned land?
Mhm.
And then what is the kind of your values compared to the other? And if there's going to be weights put on it, those are the metrics that should be weighted more heavily. Otherwise, I mean, I agree, it should just be a straight across the board the same. But if we're going to weight it, there are definitely better ways to do it than what's being done right now.
Thank you.
And then assessing the value of the land is the problem.
Yeah, I'm sure you guys have been getting pounded on that, and we get my office gets a lot, and I try to, you know, get that message out to people. It's your assessment is not the, you know, this isn't like a sales tax where you're paying a percentage of what your value is. And so if the whole county is being assessed and raised, you shouldn't actually be seeing a increase in your property taxes, because it's a formula. Most people don't understand that. We keep trying to push that message. And I know for you guys, you know, it's a state statute that you have to reevaluate. I do believe that there are things that should be looked at that would limit the amount that, you know, especially elderly living on Social Security. They've lived in their home for 30, 40 plus years. Just because your evaluation goes up, you don't realize that unless you actually sell. And so I think there are things that could be put in there to help limit that. And then when you sell, then it can come back up to whatever that sale price was or something. But to help people stay in their homes, and that could really help. If you're staying there for 30, 40, 50 years, you're committed to the area, and you should be able to see a little bit of cap put on your property taxes. So, but again, to get that agreement, I know people have talked about that
Senator,
for a long time.
you know, we talk about those ideas also.
Mhm.
The problem is the burden all stays within the people in Pine County. The
Right.
state can pass that kind of legislation and it's great. But the state never kicks in any money to help pay for it.
Right.
So if we take 10% of our taxable land and
Put a cap on it.
put a cap on it, then the rest of the people that live here have to pay for it. And it's not us making the rule change.
Right. That's why making changes to property tax stuff is always incredibly difficult. So the thing is, Minnesota is the most difficult by far to evaluate it. And if I remember right, we have 57.
Now we got 62.
Did it change? Okay, so yeah, so we have 62 categories that your property could fall into for property tax. And the state with the next highest number of categories has 15. So we are so much more complicated than any other state. It's just unreal.
Can we go back to simplifying a little bit?
No, like I said, the problem is where you run into your issues is if you say we were to go back to 10, you're going to have a bunch of people that are going to be like, well, my taxes now went up, and they're going to complain. Over a 20-year period, everything would be fine and people would be like, yeah, that was a great idea. But those first couple of years, people are going to be upset.
I think as far as taxes, one thing that could be looked at is homestead credit. You know, your valuation, everybody's values are going up so much, but the value for homestead credit hasn't changed in years.
Right.
And so a lot of people are
that-
losing all of their.
That's
homestead
really
credit.
kicked in now where people, their homestead credit has gone to zero, basically.
Right.
They didn't change anything.
Mhm. Yep, and I know there was talk about that in this tax bill, and I don't remember. I know our property tax chair was pushing hard for that one, and I can't remember if he got it included in, but I know he'll be back, and it's one of his areas that he's really gonna push for. He's from a ag area down in southwest Minnesota, and so he's really gonna continue to push for that, and that's something I'll support.
And thanks for what you did. for
Thank you very
probation,
much
too.
for coming here.
Absolutely.
Yeah, thanks.
Thanks, Jason.
Thanks
Have a
for
good day.
answering the phone too during session. Transportation Committee report. We met last week, I believe.
Yep, Mr. Chair.
Yeah.
Is this where I need to note the change in the resolution 2022-37? That there is an updated copy available that changes the number in the whereas clause, or I'm sorry, the therefore resolve clause to $2,538,122.26 rather than the 3.6 million, I think it was. So Mark had passed that out earlier.
Okay. JJ, you wanna go over what we?
It's minutes in front of me. We talked about the Bruno Maintenance Shop soil situation up there and the cleanup, state aid funding, 2022 project schedules, highway improvement plan, master partnership agreement with MinDOT, ATV traffic in Willow River. Some of them got shifted around a little bit as of the project schedules to help with the funding and money. Then the one up in, I guess the last one I mentioned up in Willow River, still some ATV traffic causing some erosion and wrecking the ditches up there. Assistant County Engineer Gunderson is going to follow up with the city on solutions there. You said there was a tank that was sold out of Bruno. Maybe you could touch on that, because that has to do with the state and another environmental concern.
Yeah, the MPCA was out looking at our sites, and we had an above ground tank at Bruno, which it wasn't leaking or anything. It was just the regulations involved got to the point where we didn't feel like it was worth keeping the tank. There was an old abandoned tank that they found on the site, and so there was some remediation of the soils there. So we we put the tank out for sealed bids, and then Bruno, what we call them, Deep Rock, purchased it, so they were happy. So I guess it just got moved down the block. So, and now we'll buy fuel from them, and it'll be sitting there. So just kind of a exchange, but they, you know, they have to have all the certifications, obviously, if you own a gas station, those types of things. And essentially, that's what they're shifting to us now, is where, you know, some of our staff could run a gas station, so, or be qualified to handle all the environmental situations. So we're looking at we have our main underground tanks in Pine City and Sandstone. We'd like to be able to keep those, of course. We go through a lot of fuel, a lot of diesel. But we're probably looking at, we've got a above ground tank in Hinckley and Duxbury that when they come down on us again, we'll probably reassess what we're doing. So.
Yeah, I personally think it's a great idea utilizing this station, the private station that's there in Bruno, and with his new pumps and accessibility with the cards. I think
Yep.
it'll
And
work
and
great.
the amount of fuel we go through isn't that much in those locations.
Yeah. Good. Thank you, Mark.
The thing that came out of it is we have a state aid advance resolution. What that means is, in order to complete the projects on our schedule, we're gonna take an advance. We've done this several times in the past, but we want to keep our schedule. We're pretty locked in for the next 2 years. So we want to keep our schedule for 22. We want to keep our schedule for 23, but this is for the 22 projects. And we might have to shift some depending on funding depending on what happens with inflation in 24, 25, 26 down the road. But we want to keep these projects on track right now.
Good.
Is there a resolution number for this?
Yeah,
It's 22
Oh, okay.
37.
dash 2037.
So I'll make a motion to.
Okay,
pass this
thanks.
resolution.
Thank you, second.
Got a motion by Lovegren, second by Waldham. Any discussion? Not, all in favor, say aye.
All right.
Opposed? And then we have a master partnership contract with
Mr. Chair?
yeah.
We had the insurance committee jammed in there.
Yeah, but can we
Yes,
finish the
sorry. Yep.
transportation? I put it in the wrong order probably, but master partnership contract with MinDOT. This is kind of the stuff we do anyway, right, Mark? But we need a new master agreement, so we can keep everybody, all the accountants happy.
Yeah, and Mr. Chair, really, the main thing we do with MinDOT is we use their lab services, so all our materials that we have to test. We do some of our own, but they've got a huge lab up there, so if we were gonna do all our testing, we'd have to have a huge lab too, and so most of the counties, they've just worked with the Duluth lab, and so we pay them for their services. The agreement does allow them to hire us to do things as well. So it's a pretty broad agreement, but for the most part, it's really for our materials testing, is that, you know, what the agreement would be for. So we'd like to continue that for another 5 years. So,
Just out of curiosity, have they ever asked us to do things for them?
you know, they've talked about it, but it's like, you know, they've got less staff, we got less staff. You know, since they want us to do stuff because they got less staff, it's like, well, we're tight too, you know, so it kind of just, we're both dealing with the same issues as far as what we can handle, you know, so. But if there's something that came out of it, you know, we certainly be willing to help them, so.
Is a 5-year agreement, is that standard usual? I guess I don't recall talking about
Well,
stretching it out.
I'm sure the senator could expand upon agreements with the state, but they're they're usually quite lengthy, quite complicated, and they employ a lot of attorneys. But it's kind of, it's a statewide thing, so they have agreements with all the cities and all the counties that want to use their services, so they, every 5 years, they update it and make changes, and so that's, you won't see this again till 2027, so.
I'll make a motion for resolution 2022-38.
Second.
Got a motion by Lovegren, seconded by Moore for the master partnership agreement with MinDOT. Any discussion? All in favor, say aye.
Aye.
Opposed? Thanks, Mark.
Thanks, Mark.
Thank you, Mark.
Insurance committee report. Terry, you want to touch on that?
Yeah, so we started going out for bids, which we had talked about after the last meeting, and he went to United Healthcare, Medica, and Blue Cross Blue Shield. United Healthcare came up with an 18% increase, which is huge. Medica came up with, theirs is better, but the best one that we've got so far is Blue Cross Blue Shield, and they're going up 8%, which is quite a bit different than 18. So we're looking at, he's still gonna go out and see if any of them can fix their bids and bring them down. He doesn't know if Blue Cross Blue Shield will come down more than that, but right now it's looking like we may be switching to Blue Cross Blue Shield. There's some fees that are gonna come out of that. One of them is a $6,700 2-month administration fee to United Healthcare for them to administer the claims for the first 2 months.
The carryover stuff.
Yeah, yeah. And then 18,000 for wellness, because they had paid us that, was it 50-some thousand dollars for 4 years for wellness money, and then we would have the years that we did not utilize that. So then it would be 18,000 going back to wellness.
That's what I'm saying. So we're gonna have to give some of that back.
Right.
Yeah.
Yep. So prescriptions, the contract is the same as what we had with resources. So I mean, it's not going to be identical to what we had when we left Blue Cross Blue Shield, but it'll be comparable. It'll be more or less what we had before. One of the hard parts with United Healthcare is their communication. We've got issues that have been out there for, I want to say it was over a year, one of them, where it hasn't been resolved yet. Trying to get them to communicate is really difficult. So, yeah.
Are the logistics gonna be the same as far as our staff? Pretty much? You know, the bills come in, we just pay it. It's still self-insured and
Still
that'll kind of
self-insured,
stay
yeah.
the same.
I don't know if did we talk about if the administration was going to be different than it was with United Healthcare?
I believe we did talk about that, and there would still just be one check that would be cut by the county.
The other thing is that our usage, just so that we know what might be coming down, our usage has been really heavy. Last year, we ended right on target at 100.2% of what they had estimated. Through May, we're at 112.5. So we're 100 or 12.5% over where they figured that we should have been in May. And June claims are gave Kelly the cringes. So it's going to be interesting to see where we come out. We've got some high.
Wasn't that kind of expected though, because the elective type things were put off with COVID and people are starting getting things done.
Yes,
So
yeah.
we knew there was going to be a spike in there.
But I don't think we thought it was going to be this high.
Yeah.
So she said that she just sent out a really high check.
But it is what it is,
Right.
you know?
Yep.
Right.
It's, I think, for me, I have to remember, we're gonna pay an increase in health insurance. Either you pay it immediately like we are now, or you pay it a year later.
Exactly.
Excessive.
You're gonna,
rate
it's
increase.
based on your usage every time.
Yeah, it's all based on usage, so.
Yeah.
At least we can see clearly what our quarterly usage is, and we know what's coming. I think that's an advantage we have over what we used to have.
The one thing I asked the group to think about, I'm going to ask you guys to think about too, is we are self-insured and we have to have so much money in our bumper. And my thing is that I believe we need to put more into that bumper than what we have been doing. I just to cover all of our butts. So I asked the group to start thinking about that. And now if you guys want to think about that too.
So I think, yeah, so last time we did a full, he called it a fulls to carry the 6 months in case we dropped. I think we still have to stay at a minimum at that plan. But I don't know,
Put anything into
what does that
last
number
year.
look like? Did he throw that out there?
I don't remember.
I missed, I'm sorry, I missed
No,
that. I
no.
was gone, but yeah.
It's, we're still okay, but we're not adding to it. That's,
Yeah, okay, okay.
I think what Terry's saying,
Yeah.
We need to keep our eye on the ball and get that buffer built up.
We kind of agreed to do that when we went
Right.
self-insured, and then last year we dropped it. We didn't do that last year. And
Yeah.
so I think we need to make up a little bit and
Did he-
make sure we do
Was he
something. this
talking a percentage number to that?
No, not yet.
Not yet.
He'll
Next
have that
meeting.
next month. The other thing that's gonna happen is, the little card you have to pay for your,
Your further card.
your further card, thank you, is after Steve finally learned how to use it, that's going away. And a different company is gonna will be issued new cards in August. And just, I think everybody's gotten a notification on that, but
That's for the healthcare savings style. Yeah.
There'll be a like 3-week blackout period where nobody can use it, so.
And from August 18th to the first week in September.
Yeah.
That you won't be able to, if you go to pay for a prescription, you won't be able to use that card.
Just keep your stuff.
All right. Now, let's move to the ME.
Yes.
Rod, are you gonna take that, the contract cancellation?
Mr. Chair, members of the board, so Rod will give a little more detail, but these two items, the 3.2 and the 3.3 are related. And so we can probably have Rod give an overview and then have questions and then take action on both of them after the.
Can I have a question first? Can I? Can I ask, so do we need to cancel one before we approve the other? So there's a.
Yeah, but let's get our little background here first on what we're doing.
All right, Mr. Chair, members of the board, like David said, this is kind of a two-part request. We'll be looking at ending MEND and we'll be looking at beginning with ACH. But before we get to that, the sheriff's office, we currently contract with MEND for our inmate medical services in the jail. We entered into a 3-year contract back in January 1 of 2019, and that ended in December 31 of 22. But it has an auto renewal each year after that, unless we, provide a reason to leave. Our current budget, just to share that, we're right now for 2022, we're at $415,000 is set for our total budget. For MEND, we pay $334,280. Other medical expenses are also included in there, which is like hospital visits, ambulance, portable x-ray, biohazard, the medications, prescriptions, supplies, office supplies, and then hospital security services we also included in there for anybody that goes out for long-term care. So that's how the budget's set at this year for 2022 is $415,000. And just a little history, back in 2017, our budget was set at 490. In 2018 was 400, then 420. 2020, we reduced that to 393, but I remember our ADP really dropped with COVID and stuff. And then 2021 was at 400. And we met those. I know there was a couple years that we more than met that, where we saved quite a bit. But we're kind of right in the same ballpark. For MEND services that we currently have right now, and the reason for some of the change and for this discussion, it would be currently MEND, they've been facing a great deal of some legal issues regarding ethics and their legal issues regarding poor healthcare in other facilities. I'm going to key on the other facilities for right now. The owner and our jail provider, Dr. Todd Leonard, he's had his medical license suspended. Mend is experiencing a great deal of staff turnover at this time that has affected our facility as well. With little to no health tech coverage as we've contracted, and our RNs are being pulled away to assist in other Mend facilities throughout the state. That leaves us shorthanded. Mend's nurse manager has been replaced at our facility, and currently I've seen him once. Usually it's a weekly visit sitting in my office so we can discuss what's the medical concerns at the jail. Sometimes it's a phone call, but rarely do we see him. And as he's being pulled away to other areas, Mend's mental health provider has also quit, and we're left with very limited services. And we all know where mental health is in jails. If anything, we need increased services. All these issues here, they kind of leave our facility at a little bit more of an increased level for liability. Fortunately, the one thing we do have going for us is the 2 RNs that we do have left here. Those RNs have kind of bridged the gap with what Mend's lacking at, and it's to them that we credit where we're at right now, but that's not going to last long because they see the writing on the wall. The jail's considered other options. Not just leaving Mend going right to ACH. At first, when we were looking at our services, we look at like public health. That's a thing that was like over 20 years ago. We used to have public health. I know, in speaking with Becky and that, and it puts a lot of liability back on the county for the services. And I don't believe that our public health is prepared to handle correctional health care in our facility. Essentia Healthcare, we considered, now we didn't reach out to them, but we have had them in the past, and we ended contracted services with them in the past because they were not prepared to, or really willing to take on jail correctional care at that time. We thought of Centra Care. We've met with them at Jail Administrators Conference. Essentia Care is really small right now. They're based out of Stearns County, and they partner with their local hospitals. Could that be something in the future if they grow? It certainly could, but they're not in our area right now providing service. The other one then is ACH, and that's Advanced Correctional Healthcare. They're a nationwide jail healthcare provider. They're strong in Wisconsin and getting stronger in Minnesota. And so we looked at them. They provided us a proposed contract of $369,398 for an annual contract, which is an increase of about $35,000 a year. The increased services, though, we would increase our services with ACH. ACH does not use health techs, which is one area where Mend has found they've some liability. So health techs are like CNAs. People are familiar with CNAs and that. They do med passes and they do some brief little assessments, but they always have to have an RN. ACH uses RNs only. They don't have anybody else pass meds other than the RNs and taking care of inmates. We have an on-site, with ACH, we'll have an on-site medical provider 4 hours a week. We currently have that with Mend also. But when they go home, we have 24/7, 365 availability to that provider via phone call. Well, it might be a couple because they're not on the phone all the time, but we always have a provider and not making a phone call to a nurse somewhere, then things get relayed. We would have on-site mental health services in the jail 4 hours a week. We don't have that right now, and that's with a QMHP, qualified mental health practitioner. Now we have more of a mental health tech on a phone with a screen. And I don't want to assume everybody knows this, but it's really tough to have a mentally ill person sitting in front of a TV screen and getting really quality service. Well, we'll have the QMHP in our facility 4 hours a week and longer if we need, where it's built into the contract. If we need longer service at a fee, of course, they would be here and available for us. They provide on-site staff training and medical training for us. They also have a CIERR program, which is a critical incident employee rapid response. So we have an incident in our facility, that a critical incident, they'll have like a debrief and they have a team come in and work with our staff. That's not available through Mend. So all in all, with the 35,000 plus increase in a year's time, we are getting something for that too, in increased services. I also believe that we would be reducing our level of liability for the county with ACH's services. We did do a cost comparison without just taking their first bid. They did come in with a high bid, And we looked at some of our services compared to surrounding counties. We looked at Isani, Kennebunk, Chisago, and Mille Lacs County, compared what services they were getting, trying to really do apples to apples, but it's tougher than that. What services were they getting and paying for, at what cost, and what services were we asking for? We reduced some things. We kind of made things mimic other facilities, but yet knowing what we really needed. And how I compared that was how many hours of somebody in our facility, whether it was a doctor, a nurse, a qualified mental health practitioner, and then compared how many hours were in other facilities. And I come down with a rate based on the cost of the average is $78 an hour. We came in with our contract at 77. So I feel we're really comparable with the surrounding facilities. We would ask at this time that we would be approving terminating services with MEND and then entering a contract with ACH. But if you have any questions, here I am.
Nice job. I think you covered everything I
I
had.
think you hit every point I could have had a question about.
Well, David gave me about a 1 hour heads up to write something, so.
I know it's been on your mind
But
for
it's,
a long time.
right, this hasn't been determined in an hour. This has been going on for quite some time, so. Any questions?
Appreciate it. No, we'll look for a motion to terminate the contract with MEND.
So moved, Mr. Chair.
Second.
The motion by Ludwig, seconded by Lovegren, terminate the MEND contract. Any discussion? All in favor, say aye.
Okay.
Opposed? Then we'll look for a motion to go with ACH as our contracted health care provider for the jail.
I'll move that.
Got a motion by Moore, seconded by Lovegren. Any discussion? If not, all in favor, say aye.
Aye.
Opposed? All right, thanks, Rod.
Thanks for all your homework on that.
Yeah,
I think it took a lot. Thank you.
okay. That all the new stuff we had to,
Yes, it is.
okay, now we'll go to our setting a schedule for our budget meetings.
Mr. Chair, members of the board, in your packet was a list of potential budget meetings starting August 2nd with the overview by the county auditor treasurer. And then meetings August 23rd and 25th for department presentations. And then an optional August 30th meeting, if on the 23rd and the 25th, there just are questions or unresolved issues that you want another meeting for department level discussion, you could call that on the 30th. And then September 6th is a regular meeting that we could have budget discussion at. And then September 20th is the last regular meeting to set the preliminary levy. And so on that schedule, you'll see there is a number 7 meeting for September 27th. If you can't set the levy on the 20th, you could call a special meeting before September 30th. But just trying to lay out, if you've been through the process before, it should feel pretty similar with regard to the meeting makeup.
That work for people? We should have a motion on setting those meetings.
I'll move that.
Second.
Motion by Lovegren, seconded by Moore. To go with that meeting schedule, if we need them all. All in favor, say aye.
Aye.
Opposed? That should bring us up to commissioner updates. NLX. Do we have a meeting?
They had a meeting, but.
I don't have any.
Okay, all right,
We're MIA.
all
They
right,
wanted to spend money. I didn't know if I wanted to vote for that.
okay. Pine County Housing HRA meeting. HRA EDA.
Yeah, that was me. Just, I don't have my minutes in front of me. Leslie was there. You were.
I was gone, but I think they're in here somewhere.
Um, Yeah, I think everything is looking pretty good with the new management company there. Nothing really jumped out at me that seemed like anything. It seems like it's been a very profitable property.
Is it?
Yeah, pretty much so, from everything they're saying. And that's about all I can really say about that.
All right.
There was some, I mean, some little stuff. There was some confusion with some locks and stuff that got taken care of,
Okay.
which was a little bit of a safety concern, but they're overall, I think the new management company is doing really well. And like I said,
Good. That's great to hear.
yeah, no,
Yep.
a lot of money sitting there in the bank and seems like it's been well managed.
Extension 4-H open house. Terry, I think you got there.
I did. It was good. It was, got to meet Sarah and which we had met her at the board meeting before
Right.
that. But they've got a lot of things coming and we talked with Jan and are going to be setting up a meeting with the Mille Lacs Band to have 4-H go out into the two different facilities that the Mille Lacs Band has for their kids to see if we can get some good programs going and to start working together there too. So it was good. That's a good discussion.
Thanks for doing that.
Mhm.
Regional Development Annual Meeting.
Yeah, that was just, they picked the new members. I arrived there late. They changed the date and time for that one, and I still had it in the calendar as a 7 PM. Business as usual, pick their new members for the positions. And I have the minutes also, in case anybody's interested, from Voss.
Thanks, JJ. Any other meetings?
I have another. So the one watershed, one plan policy, we did have a policy committee meeting. And it was discussed and at length, and they did take Mille Lacs Band out of the plan. And what they stated was that there isn't any other organization or that stated what they have. For instance, we're not saying Henriette City has this or Brook Park City has that or Mora. So they did end up removing Mille Lacs Band from all of it, which I felt very sad about. I don't think that was the right thing to do, but anyways, and Reese, they are finally gonna be getting in touch with you to
Oh,
go
okay.
over the joint powers agreement. And yeah, so that should be coming your way. So
Is that the Mille Lacs Band thing? Aren't they, I mean, they owned all this land at one time. I think.
Yep.
I understand we're in a organization that has to live by votes,
majority, yeah.
yeah,
And my comment was you can't erase them, you know?
yeah,
I mean, you just can't. And, you know, you try to emphasize that we have good working relationships.
right.
With the band. So, yeah. Oh, do we want to talk about our ribbon cutting ceremony?
Oh,
Yeah,
did you
that's
bring
in
your
the other-
scissors?
I do, they're in my car.
Oh, I forgot mine.
Ah,
Terry and I went to a ribbon cutting ceremony at the, well, it was between the golf course and the casino. And they have built a solar array with a private company doing the construction. And it's a partnership between the ECE, the band and that company. And one of the reasons it works is because of their huge load that they have. So it doesn't go beyond basically that complex, the distribution of any excess power. They use it all. And so it's kind of a win-win for everybody. It's a win for the Mille Lacs Band because they're producing power. It's a win for ECE because they don't have to buy power to help cool those places in the heat of the days. And it's a win, obviously, for the private investing company that built it because they're getting some cash back, I guess, out of the deal. So It was a feel-good program, I think, on everybody's part.
It'll be interesting to see. I liked the young gentleman. He said, now we need to figure out how much we're gonna save per slot machine.
Right.
You know, but just to see how much they save and how it works for them, just to know how it would work for other people in this community. But, yeah.
So, any other items that we need to discuss? Check your calendars for upcoming meetings. And then we're gonna go into closed session and have an annual performance review with our administrator. Any other items here? If not, I need a motion to go into closed session.
I'll move that.
Now, second,
Go ahead.
Got a
JJ.
motion made and seconded to go into closed session for the purpose of annual review of our administrator. We'll take, between that time, we'll take a 5-minute break.
Thanks for what you do, Jason.
AM and the Pine County Board is coming out of closed session to open session.
Okay. We have a recommendation, I believe, for salary for Dave, and we'll have a summary, written summary of the minutes, meeting that took place in the closed session for the next meeting. But I believe we need a motion to move forward with Dave's new salary.
I'll make a motion to set his salary at $150,947.
I'll second.
Got a motion by Moore. Seconded by Ludwig. Any discussion? If not, all in favor, say aye.
Aye.
Aye. Opposed?
I oppose.
Okay. Motion carries. That brings us to the end of the meeting. Any other business to take care of? Not, the meeting is officially adjourned. And I believe we're gonna have a broadband committee meeting.
And I think we can meet in the commissioner conference room if you want to.
Okay.
That's